All right, so welcome to the practice. So what can we do for you today's visit?
Today I'm visiting because I have tennis elbow that I got from a rowing injury.
Okay. And when did that start?
Started about 6 months ago.
Okay. So when you were rowing, I understand during the consultation, you mentioned that what started to come out first?
First, my right wrist starts sort of like snapping, a little bit of cracking going on, and then eventually it went up to the elbow.
So it radiated up there, and then, so it's pretty much stayed at the elbow, but no problems at the wrist right now.
That I feel, but it's not bothering me. But I'm sure you'll probably see something different.
Okay. All right. So the reason why I'm asking about all these questions because I want to see biomechanically how that lateral epicondylitis, the tennis elbow, how that got knocked out of alignment.
Okay.
So by the mechanism of injury, how you were pulling when you were doing the rowing, okay, and because you felt like there's a lot of popping noises in the wrist, tells me, okay, we have some kind of nerve dysfunction at the neck.
Okay.
It did not allow the ligaments to hold the bones too well, knock something out, and once it gets aggravated enough, it start irritating the bones in your forearm, and that traveled into the elbow itself, right? And it stayed there.
And so we're living there.
Right, like an uninvited guest.
Very much so.
Time to kick the guy out.
Yes, eviction now, New York now.
Kick the guy out. Okay, so yeah, we're gonna start connecting the dots and let's see, where the real problem is and take it from there.
Okay.
The very first thing we're doing is we're gonna check for visualization. We check for any signs of any potential structural damages in your spine, and the defense mechanism is going to be inflammation, swelling, and muscle spasms. So we're tracing that, we're looking for that pitting edema. Okay, we got something at this level, so I'm gonna mark it. See, you got a speed bump over here. See, it's nice and smooth here, but bump, bump. So mark these two levels, there's something going on over there, but not too bad over here. Now, we're gonna also check, see what's going on with your neck. Okay, there's a lot of muscle spasms tightening on the left side and the right side. And a considerable amount of swelling right over here. So we're gonna investigate, see what that's all about. Your upper dorsal is similar as well. Your muscles is trying to stabilize something at your neck over here. All right, so with instrumentation, we're gonna scan your spine. We're gonna look for any potential issues here. So we've got a small one over here. Another one over here. Okay. Got something over here as well. We got a reading way up there. All right. Okay, so now, what I'm doing right now is I'm overlaying the data I'm seeing in the x-ray using as a blueprint. And see this left hip, it's just slightly fixated. And the right is moving just fine. Sacrum, slightly fixated on the left. But that fifth lumbar has badly degenerated. See, that's stuck right there. That ain't moving too well right there. Now if we pump this up a bit, now we check, see how this thing's moving? See, now it's moving more. So basically what happened is this, because this thing is so posterior on the x-ray, I just pumped it up and I improved the foramen. There's a tunnel, the nerve that goes into here. Right? So I reduced the retrolisthesis, get more nerve function in this hip, and that's how it disappeared, made this false positive disappear over here. So that's how we know. It says, nope, this fifth lumbar, that's what we need to address on this fellow over here. That's a very strong candidate for an adjustment. I'm checking the mid-back. Okay, that's not too great. Now we're checking the neck. Feel that big knot right there? Feel that big swelling right there?
Yeah.
Yeah. So we're checking each one. 7, 6, 5, 4.
Oh, that feels good.
Yeah, but it's stuck. You feel that? That ain't moving. That's the fourth cervical right there. 3, 2, okay. This is where the history comes into play. So we're talking about, says, okay, you did some rolling, okay? Your starter says, oh, some loosening and popping noise in the wrist that somehow fixed itself, and then bam, that
Went straight up.
right to the elbow and never left.
Right.
Okay. So when I take a look at your neck, all right, this fellow over here is so backwards, it's just decreasing nerve function altogether.
Okay. It's not good.
So just like this over here, the nerve got to come out of this tunnel. But this fellow over here is backwards so much, tunnel collapses, pinching that nerve.
Okay.
And I can see that here, see this? There's a nice little tunnel here, tunnel here,
Yeah.
tunnel here. See, that's very small.
Yeah.
Very small, right? And it gets bigger again.
Okay.
This fellow over here, you see this? We want to line up. Everything should line up like this. But this is starting to go backwards. And look at that fellow.
Right.
That's sticking way backwards.
Right.
Same story over here.
Gotcha.
I don't want to see any of these bones sticking out. But this thing's so badly damaged and backwards, right? The thing is this disc is like sticking out over the edge. So if we don't do anything about it, just like having no different like a bowl that's gonna roll off the table,
Right.
the body says, whoa, wait, where you going? You know, we gotta keep this disc in place. That's why it's gonna start building some structural support.
Right.
Try to contain it.
It's forcing
So
it.
that's why we see this osteophyte growing out over here on the front and the back.
Got it.
The trade-off, yeah, that bone's gonna go even more into the tunnel and irritate that nerve, and that nerve is connected all straight down. Now, the interesting about it is that both your 5 and your 4 are both damaged. The 5 is directed to the elbow itself, okay, and also same thing with the 4.
Right.
4th cervical and 5th cervical nerves to the elbow. So if you ever notice, try to do hammer curls,
Right.
okay, that might be a little problematic,
Right.
right?
Right.
So now there are some nerve functions. Usually it's just 5 and 6 to here, into this part region of the hand, into
Right.
the wrist. But sometimes every person's neurologically is a little bit different. Okay? Sometimes part of the 4 may be in there, or sometimes part of the 3. It's extremely rare, but sometimes it does happen
Right.
based on clinical experience I've had with patients over here. Okay? Now that being said, that is a very strong candidate that we need to adjust on you, because we confirmed on you that thing is very swollen. It's stuck, doesn't move well. In addition to, that's what I see over here. This 4th cervical is gapped wide open on this way. And it's also very interior on this way. That means this atlas, this bone over here,
Right.
is shifted forward so much.
Right.
So the very first bone that allows the head to recenter itself is gonna be that number 4.
Right.
So that's why we need to adjust that fellow over there, okay? So now the other component is, that's where we're gonna touch base on, is also what happened down here in your low back. Similar story as well. I see a lot of tunnels here, but that one, you see, that's a lot smaller compared to these other tunnels.
Right.
And the disc degenerated very, very thin. Now, in any other time, when I take a look at this pelvis over here, this pelvis is sinking down this way. And it is shifting a little bit to the left. That means your body is doing like this. It's sinking out this way,
Cool.
a little bit this way,
Yeah.
and a little bit that way. Okay. Now, that's why I was examining on you, and my expectation is, interesting enough, that should be the left hip. But it was only partially fixated. It wasn't heavily fixated. So I had a hunch. It says, okay, that might be a false positive. That's where we pump this up. And what do you know? This thing started moving just fine.
Right.
So it tells me, it says, okay, this is a false positive. The real problem is this 5th lumbar right there.
Okay.
So we need to clear that up to provide some stability up to here.
Gotcha.
That's what's going to be the battle plan is, okay? So on today's visit, we're going to be taking care of this fella and that fella over there as well.
Okay.
To piece more things together, what you were talking about during the history, it says, hey, wait a minute, it's popping a lot.
Yeah.
And then why did the pain travel from here over here?
Right.
Okay. Now, we have ligaments. The purpose of ligaments is to hold the bones together.
Right.
Now, if you don't have enough nerve function, what happens is you start introducing slack like this. So any movement, there's too much give.
Right.
So why is that a problem? Well, we have ligaments that are attaching all these bones in your wrist itself, these carpal bones.
Right.
Now, this one is key because I want to see a rainbow arc. Okay, there should be a bottom arc and an upper arc.
Right.
This fellow over here is breaking that arc.
Right.
So this is the lunate bone. Why is that important? Because since it's now sinking down towards this way, it's pretty much like having a nice little chisel right between these bones, right in there, separating this two, spreading it out, and guess where these things are connected to? All the way to the elbow.
Gotcha.
So from here, as you can see, the lunate janus soft right between the ulnar and the radius over here.
Right.
And it transferred all straight down over here, and then this fella.
Okay.
Yeah.
Makes perfect sense. Makes perfect
Exactly.
sense.
So that's why we gotta connect all the dots, see what happened, and that's why we also took the films on your wrist
Right.
to rule that out. And nope, we got the problem over there as well. So we had to correct the issue of the root source of your problem
Right.
at your neck, and then address both ends, your wrist problem. Okay, so it could calm this out, so it won't act like a chisel to separate these two bones here.
Right.
And we'll also set this as well.
Okay.
For your tennis elbow.
Wonderful.
All right.
Wonderful.
Come on up.
Take a minute.
Okay, walk around. Tell me what's different.
Am I like an inch taller?
No, you tell me.
I feel like an inch taller. Like seriously. So I feel like I'm now coming back to the right side of my life. Like I felt a little disangled.
Okay.
Now I'm straighter.
Okay,
Yeah?
cool. All right, let's do one more test. Okay, go ahead and squeeze hard as you can. Okay, relax. 64.5.
Wow.
Okay, try this one. Squeeze hard as you can. Okay, all right, 70, almost 73. All right, so we got a baseline. There's your fourth cervical. Okay, relax shoulders. A little more. Relax.
Holy shoot. Yeah.
Come on up. That was a big clunker.
Oh. Did you hear that?
I think the whole world heard it.
Oh wow. Oh wow.
Oh, wow, what?
How you doing? Feeling good. Oh. Oh, much better. Oh, thank you.
Let's
Yeah.
test one thing. Okay.
What do we got?
Oh, also, sorry. Okay, squeeze. No, also. Okay, go ahead. See? Now it's symmetrical.
Oh, it's really? It's awesome.
Because before, what was it before?
Well, I have to tell you, it's feeling a lot better now.
Because it's now 74 and this one's 75.
Ooh.
So now they're symmetrical. Before, it was like,
Yeah.
as you guys saw before. 62, was it? Oh, 69. So yeah.
Okay.
You got about
Good.
5 more pounds of strength on that side.
All right, good.
Still not done yet.
No.
Okay. You always have problems with doing hammer curls?
Yes, it hurts.
Try it. Okay, no, show the camera. Go ahead. Do a hammer curl. How's it now?
A little bit better, but I still feel it.
Still pain there, right?
Yeah.
Okay, I want you to remember
It's
that.
like burning.
Okay, I want you to remember that. Now, the reason why we do this in 2 parts is because that is so badly degenerated.
Uh-huh.
So we did most of the heavy lifting with that knee chest adjustment. Now what I'm feeling for is this small little nucleus pulsus. There it is. It's shifting in that little direction. And this is the vector. I need to correct it. Right there. I'm gonna drop it down. Let it go. A little more. Nope.
Sorry.
That's okay. Right there. There's that vector. Let it drop. I know. I'm gonna fix a small little piece. We're gonna get the remaining piece of that. There it is. There we go. Now it's pivoting better. Squeeze. Okay. Oh, how do you like that? Okay, let me reset. Squeeze. How do you like that? So the number speaks for itself.
Okay.
So before it was like 72, 74. Now it's like 85, 87. So we've got even more strength.
Yes.
Restore even more nerve function because why? We reduce the nerve inflammation
Yes.
going on in there. Okay, go for it.
Gotcha.
Let me see. Right. Okay.
Definitely better movement.
Okay.
Yeah, this is the heaviest one. Still, I mean, like, the pain reduction is like down to maybe like 15%.
15%.
Yeah.
So it's 15% left or just reduced?
Left.
50, so basically 85% improvement already.
Yeah, already.
Okay. Now let's
That
get
was
to work.
burning before, and now it's just like a little tickle.
Nice. Okay, let's get the rest of it.
Okay.
Okay, so when I'm testing this right now, see? Stable.
Oh, yeah.
Very unstable. This is moving way too much. And you heard that it just popped a little. Exactly. Other component, see over here? It's very swollen. Oh, geez, you guys see over here? This is puffy. You feel that?
Yeah.
Little achiness there, right?
Yeah, there,
See?
here.
On this side, this is the medial side. Okay? It's fine. There is no swelling on here. So you don't have the medial epicondylitis. As in there's no gopher's elbow. But this is swollen. Now I'm checking for the radial head. Any pain here?
A little bit.
A little bit, right? But not like here.
No,
Pain
this
here.
is more here.
Right? Okay. So you also have a little radial head as well. So they're both fun. Okay? But this is more swelling over here. Okay? And now I'm going to check which one's more in trouble. Okay, so the radial head's also stuck as well. The ulnar is even more stuck. So we're going to set this ulnar first. Okay? So before we do so, first things first, we're going to pump it all the way. We're going to pump the edema out of the way first. And then we're going to set it. No, just let it go. Like.
Oh, yeah! Oh my God, I felt like I was in softball again. That's amazing.
Tell me,
Awesome.
what's different with the elbow?
Feels good. Oh my God. Wow. So that pain's not even there right now. Like, it's just, feels like a regular elbow now, finally. No burning, not constant, like, tugging and, like, burning. It's no longer there.
Want to test it again?
Sure.
Let's test it. Here you go. Test it. See how you like it.
Well, better movement. Still a little bit of burning still.
Okay. So the final juicy part, like you say, is because of the other end, the wrist. So first things first, I'm going to check, see, the radial head. No, that's fine. Ulnar is fine. Now we check the wrist. Okay, so see, this is fixed now. See, it's moving better. See, your lunate is shot.
Yeah.
See, it's not pivoting. It's very posterior. See, you can't even supinate it too well either.
Right.
Your thumb's locked too. Okay, so first things first, let's set the lunate. Here's one piece. Thumb. Here's the other one. Checking your capitate. See, even you jam your capitate out a little bit here too.
Believe it.
Yep, so we're gonna set this a little bit this way. Okay, no, just let it go. I'm gonna sit a little more like that.
Ooh. That is interesting.
Yeah, because like I said, you jammed everything up there.
Oh, yeah.
Hold on, I gotta close this off. Now try the wrist.
I can feel like it's tingling in my fingers now all of a sudden. Huh. Just when you thought you had no numbness, and now, like, you realize, oh, I did. Fantastic. Yeah, great movement. Feels good. Oh my goodness. You want to do the weight? You want to see if it worked? Okay, here we go.
Let's do it.
Oh my goodness, so much better. So much better. Yes.
All right.
I'm like gonna be so muscular on one side now. That's fantastic.
You're gonna be like the Red Sonja, all dieseled up.
All one arm. Yeah, it's just the movement. Oh my goodness, so much better. Oh, I can actually do that. Before I couldn't even do that with any weight. Like I was like, ooh, that burns, it hurts. Like I don't want to do that anymore. But that's fantastic. Thank you.
Oh, you're very welcome.
Thanks, Doc. Oh my goodness. I am so glad I saw you on Instagram. Great marketing right there.
Oh, thank you.
Oh my God. Yeah, so much better. You can feel, and even my neck, everything is a little lot looser. I feel much more centered. Head's straight up now. Less pressure on my neck. Because I guess I was overcompensating.
Yep.
And yeah, feeling great.
How'd you like to do an encore?
Yeah, let's do that.
So you just mentioned to me that you got sinus issues.
Yes.
Close in on that.
Yes. Can we take a look at that? You got any magic there? You got anything left in your kit?
Oh yeah, let's do it.
Right.
This is supposed to be nice and straight. But right now I'm seeing it tilted like this way. So that's your deviated septum. Your maxillary sinus, see, it's clear here, but this is all white and clouded on the left side. So no, we gotta set that one as well. Okay. So let's get to work. Yeah, a little more. Gotta get this piece. I know. Get a little piece. There it is. Get your nasal bone in place. Good. Yeah, this is really jammed. There's your left.
Sorry.
Left frontal. Even the left finger was out. Everything on the left side's out. Okay, come on up.
Why does it feel like I just got a facelift? Do I look 50 years younger? Oh my God. Oh, I can breathe out of both nostrils. Did you fix the deviated septum?
Yeah, we did.
Oh, really? Like, it's no longer deviated?
Well, you tell me. How's it feel?
Fantastic. I can breathe out of both nostrils, like literally 100% each. Normally, 50% on one side.
50% usually, huh?
Yeah.
Okay.
But most of the time. Oh, can't wait for allergy season.
Okay.
That's fantastic.
Oh, you're very welcome.
Oh. And my ear was like clogged a little over here. And I could actually, there's no clogging feeling anymore. Doesn't feel like I'm underwater. It's good. Fantastic.
Nice.
Thank you.
Oh, you're very welcome. You're all set. We'll see you next time.
Thank you.
All right, so welcome back. So clue us in. How's everything? How's the wrist, the sinuses, the tennis elbow?
Sinuses are fantastic. Tennis elbow, still a little bit of like feeling like it's still injured, but definitely about 45% like growth and improvement.
Great.
The wrist definitely sort of is now the focus. I feel like everything moved up there, which is fantastic. So now we know what really caused the problem, and I was being naughty. So, and my back feels great. I know that we did lower and up my neck.
Yeah.
My posture is a little bit better.
Great.
I don't feel any pain other than,
Awesome.
when I work out.
How are things in terms of doing the hammer curls and lifting heavy stuff with that elbow now?
So now I don't have sort of a shooting pain anymore after lifting anything.
Good.
So that's a great thing.
That's a great progress.
And I've actually been able to do my 25 push-ups every morning now, where I couldn't even do it before. It was just constant pain after that, so I stopped doing it. So now I can do my 25, which is fantastic, and hopefully I can get to my 50. But yes, and now I'm sort of focusing on making sure that I keep the wrist stabilized whenever I do any exercise now. So
Hey, that's a great update. Okay, so that's the reason why we still got to work on restorative nerve function from your neck and your spine, and we'll keep working on that to keep on chipping away and get that tennis elbow a lot more better.
Right.
Oh, well, thank you very much for the update.
Thank you.
You're welcome.
I thank you. My life was pretty stagnant for a while, so no, I'm feeling much better and much more positive. So, thank you.
Oh, you're very welcome.